Good afternoon, everyone. My name is Shannon Kupka with Comagine Health. I'd like to welcome you to our half-hour Hot Topics series. These webinars are designed to support your efforts and provide you great ideas on caring for your residents in a 30-minute time frame to accommodate your busy schedules. They're brought to you by the Comagine teams from Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. We appreciate you joining us, and we're here to support you in the midst of this incredibly stressful time. We'll be recording and posting this session for those unable to attend today. We would also like to send a special thank you out to CNAs across the country and wish them a very happy CNA week. So a couple of housekeeping details before we start. Please let us know who's on the webinar today by entering your name and facility in chat, as well as the names of any folks joining you, so we have an accurate head count of participants. Your cameras and microphones are muted. If you'd like to ask a question, please enter it in chat and we will facilitate a question and answer session at the end of the presentation. And please make sure you're chatting to all panelists and attendees. We are really excited about today's presentation, which is the first of two parts on boosting your mental health in a crisis. So Dr. Alexis Kennedy is a trauma researcher at the University of Nevada, Las Vegas, and the founder of Compassion Recharge. She is a forensic psychologist who has worked for decades on the issues of child abuse, sexual violence, and human trafficking. Her research and teaching for the past 6 years has been focused on the cumulative effects of working with victims and people in crisis. She works with first responders, healthcare workers, and other helpers throughout the US and Canada. I will now turn things over to Dr. Kennedy, and let's do a quick test audio with the group. Dr. Kennedy, can you say hello so we can make sure people can hear?
Hello there.
And folks, just give me a chat to let me know if you can hear all right. Okay, great. Dr. Kennedy, you may get started.
All right. Grab the screen, share, and start. Okay, hopefully the PowerPoint is up and it's working. So thank you for the introduction. And if we were in person, I would ask everyone, how are you doing today? And most people would say, I'm fine, I'm good. But the reality is that sort of trite question doesn't mean the same thing anymore. We're not fine, and we're going through some pretty extraordinary times. And while we all try and stay really positive and say, well, it could be worse, it could be a worse situation, we have to acknowledge the toll that what we're going through cumulatively is really quite something different. And we don't talk enough about staying healthy and mental health. We are talking a bit about physical health. I know that now that we're not going out to restaurants or spending more time at home, even if you're going to work, you're spending more time in your off hours at home. There's been a lot of talk of weight gain and comfort eating and things like that. But we all know at an intuitive level that when we're taking care of our body, we're exercising more, we're eating healthy, we're making, choosing vegetables over sugar and flour and the things that aren't as good for our bodies. We remember to take our vitamins, that we just feel better. We look better, we act better, we feel better, and we need to sleep as well. When we're losing sleep, that affects us physically. If we're treating our body right, we handle things better. We're better equipped to fight off disease. We're better equipped to fight off things that are challenges. And although we know that on the physical level, we don't always think about it on the mental level, but it's absolutely the same thing. And we've seen this very much with the pandemic, the people who had underlying health conditions, who are already battling, respiratory illnesses or certain fragileness, aging, diabetes, sort of other things, they have not been able to fight off the virus the same way. It's absolutely the same thing with mental health, is that people who already had a lot of anxiety, had a lot of stress, had underlying mental health conditions, the stress that has come from the world changing so dramatically and our behavioral health having to change so quickly in terms of how we interact and what we do, what our resources are, it's really had a huge toll. But really, it's affecting everyone. It's not about necessarily underlying conditions. This crisis has changed our ability to function. It's changing the way our brains are working, and that's what I really wanted to talk about today. One of the people that works in compassion fatigue as well out of Canada made this infographic up, and I really like it. And basically, Dr. Thompson was saying, this is your brain on COVID. So before we even started this crisis, so thinking back to February or early March, we all had a lot of things bouncing around in our head. We had our own problems and parents and kids we worried about and work and all of these different things. And that was taking up a huge part of all of a sudden we were asked to process and understand this huge, weird change that was worldwide. And so the amount of time we've spent trying to understand the news, understand what's going on, try and predict the future, try and figure out how long this is going to last, that took up another significant sort of chunk of our brain power. So what we have left to feel energized, to feel motivated, to focus, to read, to do things we used to do, it's a very tiny sliver. And this is something that we're not talking enough about. It is, this COVID experience, it's a marathon, not a sprint. And it is a massive mental health burden that we're all going through. And yet we're not exactly talking enough about it. So the goal really of my talk today was to sort of give you a chance to think about and reflect on, how are you handling what's going on? Do you feel different? Does your brain feel like it's operating differently? And what can we do, some quick strategies to try and stay positive and healthy in what is a difficult time for everyone. And even if you're still employed or not sort of suffering financially as much as other people, we're all still worried. I know people are saying we're all going through we're all in the same boat. We're not all in the same boat, but we're all in the same storm. And so sometimes when we're feeling bad or feeling anxious, we then start to feel guilty, like, well, I don't have as bad as someone else, or at least, my family's all still healthy, or at least. We like to compare. The reality is everybody is going through stress and everybody is going through trauma. And even if we're not suffering immediately, individually, we're all worried. We're worried about the people close to us. We're worried about, everyone. And so that is taking up and changing the way we can interact and the way we normally do. So the key thing I wanted to talk about is our fight or flight system. And that is a very adaptive system that we have. In the old days, if we sensed that there was something watching us from the bushes, our body would immediately, our brain would take that information, the visual or auditory stimuli, and it would turn on our fight or flight system. So we would activate parts of our body to say, let's get ready to handle this crisis. We may not know what the crisis is, but it starts that trigger. So when we go into fight or flight, and I know I like to get kind of sciencey, but really the more we understand the interaction between our body, our brain, and our thoughts, the better able we are to sort of stop and intervene and handle it a little bit better. So when we go into fight or flight, our body turns on our sympathetic nervous system, the things we need. So more oxygen to the lungs, a heart rate increases, more blood to our extremities so that we can run, our eyes dilate so that we can take in more information, see where the lion in the bushes is. The things that we need, it turns on our hormones as well as the sort of neurochemical emergency system. What it also does is it turns off the things we don't need in the moment. It turns off our digestion because we can digest lunch after we run away from the tiger, or lion. It's good, adaptive, that we turn certain systems off that we don't need in that moment because survival is the most important thing. So we turn off our digestion, we turn off our healing, we turn off our reproduction, and often we interfere with our sleep as well. And that's fine if you're going to have this short crisis situation of fight or flight. But if you stay in fight or flight and you don't go back to the relaxation, you don't turn back on your digestion, you don't turn back on your healing, that constantly being in fight or flight is going to take a toll on us physically, mentally, emotionally. And that's something that we need to talk more about because we're being thrown into fight or flight because of this crisis. So a couple of key brain structures I wanted to talk about with the fight or flight system. The first one is our amygdala, which is sort of a basic part of, it's our alarm system in our brain, and it's part of our more interior sort of reptilian basic brain structures. And it's very good to have an alarm system that goes off. I mean, the people who notice the lions in the bushes first are going to be the first to run and the last to get eaten, and that's an adaptive thing. But people who've been through a lot of stress, and particularly people who've had adverse childhood experiences or been victims of violence, because we've been in sort of these extreme life or death or sort of emergency situations, the more your amygdala fires, the more efficient it becomes. So people who have a history of stress or a history of trauma, their amygdala, their alarm system is going to be more reactive. And I like the image in the bottom where, one alarm or sound to one person might sound pleasant and to another person sound unpleasant. It all depends on our history. So people who hit the pandemic with stresses, with family issues, with worries, with anxieties, having the the sort of pandemic on top of it, we already had this sort of sense of alarm system going off. And that's something that we need to understand, is that this news and the stuff that we're being asked to sort of understand around the pandemic is triggering our alarm system, which doesn't distinguish in our body. It just sends off the alarm for everything. And that also very much interferes with the hippocampus. And the hippocampus is another sort of primitive brain structure. I like to think of it as like the filing cabinet. That's how we retrieve memories. It's how we encode memories. So when your alarm system's going off, when your body is trying to react with fight or flight, it interferes with your ability to retrieve things, to think properly. And people who come from a history of adverse childhood experiences or had a lot of stress beforehand already had this dysregulation, already had this ability to sort of send them into the less efficient things. So a lot of people are talking to me saying, well, I'm just not making decisions well at work, or I'm not as sharp as I used to be. And that's because you've got these alarm systems and all of these things that are being triggered, and it's interfering with your ability to make decisions and to pull out the information you need to make the choices that normally you're a lot sharper and able to do it. So you want to be kind. It really is that your brain is being taken over by the stress hormones that we're producing. So what having anxiety and what having all of this sort of fight or flight constantly being on for us does is that it changes what the pathways are doing in our brain. And so the amygdala, the warning system to the hippocampus, that's a really strong connection. It has to be strong when there's an emergency. Your body has to respond quickly and be able to, the only thing it can pull, if you picture a little hippo in a filing system, what the hippocampus pulls is, escape routes, not, the extraneous stuff that normally we might need for our day-to-day. So you could be sitting in your office and know exactly, which exits are there, but you can't focus on the stuff that's in front of you in your file. That's actually your body responding to that stress. And what the brain does, which is kind of amazing, is that when you're in that, it's an emergency, it's a time for action, your body actually draws blood from your cortex, this sort of outside logical part of your brain, and puts it all into your more interior reptilian brain so that you're ready to run and you're ready to do things. So we can actually, if I put people under an MRI with stress, we can see how that stress response is sort of depriving parts of the brain that's our more reasoned logic part and putting it into the sort of more basic response part. So if you're not feeling efficient, that's because your body is choosing to send the resources where they think it need it, which is in our fight or flight. So it's adaptive to take the blood and put it into our sort of more reactionary brain, because we need to just run or do things, fight or flee, not think deeply about, the philosophy of the situation. So you want to know that it's not just you, that this is something that your body does adaptively, but it's going to interfere with our ability to do higher reasoning and to sort of stay really well resourced at work. So the sympathetic nervous system is a good thing. Absolutely. It keeps us alive. It keeps us surviving. And it's good that it has this ability to hijack everything else. And it's like this switch that flips on. You're ready to run. You start producing the different hormones and things that you need to get all the systems activated and going. You're ready to do it. You're less likely to feel pain. You're going to be more aware. Turn on the other organs that'll be part of that. But that's only good if it's a short-term response. And if you keep that switch flipped on with all of these stress hormones coming and all of these reactions sort of ready to go, it's going to exhaust you physically and it's going to exhaust you mentally. So being in this constant state of readiness is, if there's not a sort of fight or flight, there's not a sort of lion that we can see in the bushes, our body translates that to anxiety. So people who already had social anxiety are having panic attacks for the first time. People who had panic attacks are having even more panic attacks. And that's just simply all of us being primed and ready for what we don't know. We just know that something has changed and something is really, really different. So COVID has become for us, for most people, something that makes us anxious. It's always in the background. We don't know the end date. This is really different than other crises, like when we have natural disasters and we know that the storm's coming and then it comes and then it sort of abates, or what we dealt with here in Las Vegas was our mass shooting. And, we had a lot of dealing and understanding it and then healing people, and then sort of we came back down. COVID is just climbing. We don't know when it's going to end. It's building on the stress of things that we're already dealing with, and there's no answers. we're opening up, but our numbers are just as high. Masks work, they don't work, we're back on with masks. It's a very confusing time. And the human brain hates ambiguous and undefined pieces of information. We want to know, we want to look to history. We're looking to the flu that we had in the early flu and looking at our patterns and cities that worked and didn't work. But this is a new virus and we don't have the answers, and we now might have, transmission when people are asymptomatic. That is so dissatisfying for the human brain. We want to know an end date. We want to know how to fix this. We want to know when it's going to be over. And that is just like constantly having an alarm. If you've ever had, like a fire alarm go off in your house, like eventually you kind of tune it out and you stop noticing it and think, okay, I got to replace the battery. But eventually, it's still there in the background. And then when it turns off, all of a sudden you're like, oh, the peace and quiet. We're going to all feel that when COVID goes off. But until then, we just have this constant fire alarm going off in the back of our brain. And it's complicated because, some moments we'll be totally overwhelmed with like, am I going to catch it? Will I give it to someone I love? Or, I'm through it. Will I catch it again? And if you get calmed down about your personal thing, then you start thinking about, well, what about the economic loss? And what about all the people who are going to, lose money? The social isolation is really stark. And, we're at the point now where we don't just miss the people we love. We actually miss the people that annoy us. Like, it's very strange to not be able to hug people and do the interactions that we have. So the isolation is a huge thing. Then we've got politics. We've got a country on fire, big issues coming up. And it's not just that, it's the entire world. And that is overwhelming when you think too deeply about it, but something that we can't not stop and think about. And it's something that just means there's a fire alarm going off in the back of our brain all the time while we try and turn off work and focus on family, or try and leave our family worries and focus on work. We have to understand that is just always going off in our brain. And because we can't run, we can't flee, we need to fight. So how do we tell our bodies, okay, I'm primed, I'm ready for action. What are we going to do to respond to that? So the antidote to the stress response, while we can't maybe turn off the alarm completely, we can take a break from it. And so the way we do that is to try and, instead of being hijacked into our sort of fight or flight, we want to go back into the relax mode. But telling yourself, okay, just relax, that's not a very efficient thing, because the more we worry about being relaxed, the less relaxed we are. But we can choose to practice techniques that focus on our parasympathetic system, that tell us, okay, you're safe right now. So one of the things a lot of people have been doing actually is comfort eating, because when you are in fight or flight, you turn off your digestion. But if you're comfort eating, what that does is it's generating saliva. And so it's sending a message to your brain. They're like, oh, I'm eating now. I must be out of danger. Therefore, I'm in, my parasympathetic system instead. So there's actually a science behind comfort eating, but it's also something that the more, if we're comfort eating poor choices, then we're filling our body full of sugars and things that are going to interfere with our ability to calm down and relax. So mindful eating is a better response than comfort eating. Of course, most people turn to comfort eating, but just having that moment where you're present, where you're focusing on the fact that I'm sitting here, I'm having a meal, it tastes delicious. I love broccoli. Let's say you're making the right choices. I didn't mean to roll my eyes there. I do like broccoli. But in that moment of just focusing on eating, you're displacing the stress in that moment that you're being mindful. So I'll talk about more specific strategies, but breathing, anything you can do to relax, distracting your brain, those are things that will sort of help us take back and turn off that alarm and emergency system. So we all get trapped in these feedback loops. We watch the news, we're waiting for new information, there's another famous person who's died from it. When we see that news, even though we're safe in our home or in our car or wherever when we get it, our body responds. It moves into the fight or flight hormones, which means that our heart starts racing, our breathing increases, and then our brain has to say, wait, why am I anxious? Am I in danger? Am I scared? And we become this big feedback loop. So we have to remember that our bodies and our minds are springs. And right now, the pressure that we have with COVID is really crushing our springs. We don't have as much bounce back. So when little things happen, like you get cut off in traffic, we don't have that ability to sort of absorb more stress or annoyance. So we're going to be shorter tempered. We're going to be reacting more. And that's where taking time to relax and invoke the relaxation response is going to break that cycle. So when we get worried and we move into fight or flight and our heart starts racing, if we can say, okay, I'm safe, that person's just stressed out as well, let me do a couple of deep breaths or hold my breath for, a few seconds between inhaling and exhaling, a few counts, not a few seconds, we can get out of our fight or flight. We can recognize that the alarm bell is going off again and say, okay, let me breathe. I'm safe in this moment. It doesn't mean you're not going to get triggered again when more news comes up or more things happen, but the faster that we can get that interruption and go into our relaxation mode, the less the sort of spinning will do. So the more you practice relaxing, the better you get at it. So I wanted to give you 4 strategies to try and help you invoke your relaxation response. And the first most important thing for our mental and our physical health is sleep. Unfortunately, the more sleep deprived we are, the more anxious we get, and the more anxious you are, the less likely you are to sleep. So it becomes this really vicious cycle. And I'm sure a lot of people are going through that right now. My colleague, Dr. Jyoti Samra, has some sort of sleep hygiene, she calls it, some tips to try and improve sleep. And the first one I'm finding the most difficult because I've not been sleeping very well. And she says, don't nap as it interferes with later sleep. But for those of us who get to work at home, you're sitting in a comfortable chair and all of a sudden you find yourself nodding off at 11 in the morning. We want to push through, get up, walk around, and try and improve our sleep. Setting a regular wake-up time is important. Everybody's schedule is different now, and we don't have to set alarms if we're working from home necessarily. But the more pattern we get, the better the body responds. One of our tips is to expose yourself to natural light as soon as you wake up. So open the curtains and look outside. Limiting caffeine after noon. Caffeine has a 6-hour half-life. It does stay in our bodies. Limiting alcohol. People are choosing alcohol as a coping strategy. While it may allow you to pass out drunk, it actually interferes with your ability to stay asleep. So alcohol is not a good strategy for sort of improving your health, mental and physical. If you are a ruminator, and most of us are, when we get to bed and our mind starts racing and we're thinking about the news stories we saw today or things that we're worried about, if you keep a little notepad and write it down, if it's your to-do list or things you're worried about, that really helps you release those thoughts and get away from the ruminating. She also recommends only do sleep or cuddling in your bed. Don't watch TV, don't use your computer in bed, because that is something that also will sort of make those sort of mental connections between stress and when you're supposed to relax, and to keep your temperature lower. It's tricky, but sleep is, finding a way to prioritize your sleep really is one of the best, quickest health benefits you can do. The second thing I'd say is also be kind to yourself. Know that you're not your normal self. So if, a kid comes in and asks for something and you just absolutely lose it, or, you're trying to sneak away and you're in the shower and all of a sudden you're sobbing in the shower, that's okay. That is the excess nerves in your system. That is the excess stress you've been carrying. And sometimes we have to hit the wall. Sometimes we have to just let ourselves break down and cry for the world, cry for ourselves, cry for the people we know, because we are emotionally raw. We're primed. Our fight or flight has us on edge, has us absolutely sort of vibrating with this energy. And so be kind to yourself and understand that this is something we're all going through. I mean, we don't want to turn into super cranky people, but we do have to sort of understand that just like we give patience to people around us who may be overreacting or stressed, kids who've been stuck at home for a bunch of months now aren't quite themselves. They're bored, they're anxious. We're the exact same way. I wish we'd called it physical distancing, not social distancing, because we need our social connections. That's how we heal. When we go through a stress, when we go through a grief or a trauma, we heal by talking to other people. If it's, hardcore, it's with therapy, but softcore is just our family, our friends. We just need to talk. We talk things out. And whenever we go through a grief, that's part of why we have funerals, why we have memorials and things where we need to get together and share and say, look, we're all going through this and we're here to support each other. And that's sort of been taken away from us in a lot of ways with the physical distancing rules. But the good news is for your brain, talking to someone on Zoom or talking to someone on the phone has that same release of our, happy hormones and our social connectedness. So it has a huge benefit to talk to people. So when you get that message, like, I've got to do something, I'm in sort of fight or flight mode, pick up a phone and call someone. And that you will notice at the end of the call, you feel physically different, because that social connection, talking to someone, even if you're not going to complain, but you're just giving them a chance to complain, being helpful to someone else is something that will immediately change your mental state. Let me skip that, I'm running out of time. The The other thing about connectedness is it also can be animals. So I know a lot of people have gone, you know, to the different animal shelters and borrowed or fostered animals. But there's a lot of really positive research that says cats and dogs and animals are a form of social connection. And when you are taking care of their needs, you know, feeding them or taking them for walks, meeting their schedule, you're getting out of your mind. You're displacing your stress. So, you know, if you don't have an animal, borrow your neighbor's dog and go for a walk. It can be incredibly therapeutic and an amazing way to displace that stress for a short while. And the final strategy is to listen to your body. And we tend to not listen to our body because we've got so much going on. You know, we're just trying to hold it all together. But when your anxiety is activated, again, it's your brain saying, do something, take some action. I'm in fight or flight mode. I need to do something. So moving your body, listening to that, you know, where you've got your aches and pains, walking is one of the best things that you can do to dissipate the sort of stress and the tension that you're holding in your body. But any kind of exercise, ride a bike if you haven't done it for a long time, anything that you're doing that forces you to concentrate on the activity that you're doing. We just got a cornhole set, so, you know, throw bean bags around. But that point is when you're concentrating on getting that little bean bag in the hole across the way, you're displacing the stress thoughts. So any exercise, any activity that you do is going to have a positive benefit on your brain. I recommend the dance. I'm going to talk about that in a second, but yoga and meditation as well. You're focusing on your breathing. The research that shows how much healing you can do through yoga for veterans and people who've been through trauma is really kind of incredible because your body needs a break from the thoughts ping, ping, ping around your mind. So when you're having to concentrate on something else, like just your breathing, it is incredibly healing. It actually heals the brain structures that have been traumatized. So activity can be doing jigsaw puzzles, making bread, coloring, anything. I've been sewing masks, anything where you have to concentrate for a minute on something else. That's a minute you're not worrying about pandemic or something. It can be comedy. It can be watching television. I know people are worried that there's been a lot more screen time for our kids and for ourselves, but we need that. We need a break from the news. We need to concentrate on something different because when we're thinking about that, we're not thinking about the stuff that's stressing us out. So any kind of physical activity or sort of mental activity, it reduces your stress hormones and it increases, if it's something you love doing, like gardening or knitting or something with your hands, it's going to release your happy hormones like endorphins. And that is the antidote to stress. So we want to fight back this anxiety that is hijacking our brain, and we want to fight it at the neurochemical level. So dancing, the 5-minute dance party it's kind of, you feel silly as can be when you do it, but this is a protocol that comes from the Center for Mind-Body Medicine, and they travel to war-torn areas. They've done it with kids in Israel who've been bombed. They've done it in Syria. And what they do is they get people who have been going through extreme trauma. They put on a song and you have to dance for 5 minutes straight and like goofy, like arms going dancing, because what you're doing is you're taking back that fight or flight sort of response, but you're also releasing all the stress that you've been holding in your arms and your systems and your tendons. And it actually completely changes the way you feel. So if we had more time, I'd put music on and make everybody dance around and do the 5-minute dance party. But we forget to dance, we forget to move, but that is one of the most powerful things that you can do to release the stress that you're holding in your system, and it instantly reduces your cortisol. So I have my meditator here kind of peeking. If you're doing yoga and breathing and all you can manage is to breathe and you don't even get to anywhere zen, it doesn't matter. Anything you do that makes you stop and listen to your body and sort of be kind to yourself is absolutely going to be fighting anxiety in your brain. So I think I made it through in time. I do tend to talk quickly and I get very excited about brain science.
Yeah, this was wonderful. So we're gonna take a minute to do some question and answers. And so while we're doing that, I just wanted to make a quick announcement. I'd like to briefly tell you about our new Comagine Health initiative. So we're embarking on a partnership to reimagine healthcare, working with providers across all care settings on issues like improving patient safety, increasing access to behavioral health, addressing opioid misuse, and improving care transitions by reducing admissions, readmissions, and emergency room visits. Providers joining the partnership will receive expert coaching and technical support, education and resources, and will have access to their performance measures through our new interactive data portal. And this is all at no cost to you. I will put our link in chat to join for anybody who is interested. And so if you have been finding benefit from our hot topics, our prevention gems, and having access to your performance reports, I'm going to invite you to please go ahead and sign up with us today. And so, oh, thank you, Leah. She's put that in there. So we have a couple of questions, couple minutes for chat, and we understand if folks might need to jump off, but if you can hang with us for a minute or two, that would be great. So Jeff had asked, is it possible to counter the overwhelming fight-flight experience for ourselves or for others? And I think you've addressed some of that here.
Yeah, and it's a constant battle because, you know, you might be relaxed for about 5 minutes and then someone comes in with a new demand, or kid needs something, or your kid melts down, or your parents do something stupid. So it's that constant, you know, okay, let me get back into my relaxation state. It's the more you do it, the more you take time to get out of fight or flight, the more efficient you become. So the more time you spend focus on relaxing, the better you're going to get at it. But even, you know, the most Zen people on the planet now are stressed out. So we just have to keep trying.
Definitely. We had a question on what can we do to interrupt these cycles in our staff? A lot of this, of course, is focusing on what we can do for ourselves, but is there something that you'd recommend leadership can do to help employees decrease their fight or flight?
Leadership is so important. I was at an all-day conference yesterday with organizational change, and it's recognizing, first of all, leaders have to take care of themselves so that they're not snapping and sort of not handling it well, and recognize that everybody's stressed. But really, it's educating their staff and letting them know, you know, if you need to take a walk for a minute, or you need a break, or, you know, understanding that nobody's operating at 100% right now. So leadership really wants to support people. When you have a colleague who is sort of spinning out of control, you know, it's being able to say, hey, you seem a little stressed. Is there something I can help you with? Or, you know, finding ways to support each other. It's tough because sometimes with coworkers, you're kind of like, I got my own stuff. I don't have time to deal with you. But if we don't help our coworkers and they sort of spin out of control, we're going to pick up their work anyway. So strong leadership that understands the importance of mental health is the best thing an organization can bring in.
Okay, great. We had a couple comments about loving the idea of a dance party for staff and residents and moving around, and also a little lively banter about mindful comfort eating. Lisa had asked us in regards to napping, what about those who are above a certain age? She had heard it's healthy to take a nap if you're a senior. Should they still try to continue to take a short nap midday?
Yeah, napping for seniors is sort of different. I was thinking more of workers and those of us that aren't quite at napping age, but it's just if you've really finding that your normal sleep schedule is off, but our sleep schedules change as we age. It's different when you get older.
Okay. I'd also like to just take a moment to answer a couple of questions about if this would be recorded. We are recording this session, and we'll post this on our website and send it out to folks before our next session. Let's just take about 10 more seconds to see if does anybody have any final burning questions. Oh, thank you, Lisa. Lisa said it was great information, and I concur. All right. We also, in our invitations for the next session, will send out the remainder of our 2020 hot topics. We have a link to all of our recorded sessions from earlier this year, and we'll also send you the post of ones prior to 2020, so you can check that out in our resource library. So seeing no further questions, I'd like to thank Dr. Kennedy very much for a great presentation today. Those of you still on the call, letting you know that we will have our next hot topics on July 17th for a part 2 to this session, which will be a presentation on recharging compassion and minimizing burnout. So thank you so much, Dr. Kennedy. This was really amazing information and very practical strategies. And I'd also like to thank all of you for joining us and for all of your efforts to keep residents safe and well cared for during this challenging time. We're here to support you, so please don't hesitate to reach out. And with that said, we'll conclude Hot Topics for today. Thank you so much for joining us, and have a wonderful weekend.